High blood pressure or hypertension is one of the most common lifestyle diseases today. It affects 1 in 3 people in the United States and 1 billion people worldwide. When your blood pressure is too high for too long, it can cause countless problems like diabetes, stroke, heart disease, and kidney failure. Blood pressure is measured in millimeters of mercury, and two numbers involved in the measurement. The top number represents the pressure in your blood vessels when your heart beats. The bottom number represents the pressure in your blood vessels between beats when your heart is resting. According to the American Heart Association, 120 over 80 is considered to be the normal limit. The range between 120 over 80 to 140 over 90 is referred to as pre-hypertension, and anything over 140 over 90 should be addressed. It's important to note that one reading does not indicate that you suffer from high blood pressure. The numbers need to be steady over time. Blood pressure generally is higher in the winter and lower in the summer. That's because low temperatures cause your blood vessels to become narrow, which increases blood pressure as more pressure is needed to force blood through your narrowed veins and arteries. Possible causes for high blood pressure. Common causes or contributing factors of high blood pressure are obesity, genetic factors, excessive drinking, high salt intake, poor eating habits, lack of exercise, stress, birth control pills, pain relievers, and kidney disease. The good news is that there are many natural ways to lower your blood pressure even without medication. In this video, you're going to learn 10 effective ways to lower your blood pressure naturally. Number 1. Eat less salt. Cutting your salt intake is one of the most important ways to lower your blood pressure. A number of studies show that decreasing sodium intake can lower blood pressure. The recommended daily sodium intake is 2300 milligrams or 1 teaspoon. If you have high blood pressure, limiting sodium to 1500 milligrams a day should drop your blood pressure by 5 or 6 points. Most people eat too much salt without realizing it because sodium is hidden in so many foods. To decrease sodium in your diet, try these tips. Read food labels. Look for low salt or low sodium versions of the food and beverages you normally buy. Eat less processed foods. Nearly 80% of the sodium we eat comes from processed, pre-packaged and restaurant foods like bread, pizza, poultry, soup and sandwiches. Prepare your food at home by adding less amount of salt. You can use salt substitutes such as garlic, spices, herbs, and other seasonings to add flavor to your dishes. Number 2. Do regular exercise. Several studies have shown that regular exercise can help lower blood pressure. Regular exercise helps make your heart stronger and more efficient at pumping blood, which lowers and drops your blood pressure by 4 to 9 points. Walking at least 30 minutes a day can help lower your blood pressure. More exercise helps reduce your blood pressure even further. Remember that exercise is not just going to the gym. It can be gardening, housework, or playing a sport. But aerobic activities like walking, dancing, jogging, riding your bike, and swimming are highly effective in reducing blood pressure and also best for your heart health. Number 3. Lose weight. If you are overweight, losing weight can significantly lower high blood pressure. This effect is even more significant when you exercise. Also, losing weight will lower your risk for other medical problems. Several previous studies shown that losing every 2 pounds should result in a drop of 1 point in blood pressure. Number 4. Eat healthy. A diet program called DASH was created specifically to lower blood pressure. Research on this diet is so positive that it is now considered one of the most important natural ways to control high blood pressure. This diet can drop upper blood pressure number up to 11 points. In this diet, you should consider eating fruits and vegetables, especially berries, which are high in antioxidants, whole grains, high protein foods like fish, eggs, poultry, and unsalted nuts, low fat dairy, foods that are high in potassium and magnesium like leafy greens and beans, calcium rich foods like low sugar yogurt. In this diet, you should stay away from or cut back on processed foods, foods that are high in total and saturated fat, sugar, salt, refined carbohydrates, caffeine, and alcohol. Are you enjoying the video? Then give it a like and share with your friends to help the channel. Number 5. Reduce your stress. Lowering your stress helps keep your blood pressure normal. Finding ways to reduce your stress is important for your health and your blood pressure. There are lots of different ways to successfully relieve stress, so find what works for you. You can try practice deep breathing, take a walk, spend time with your friends and family, read a book, or watch a comedy. Studies have shown that listening to music daily can help reduce blood pressure. Number 6. Try meditation or yoga. Several research studies shows that both meditation and yoga helps lower blood pressure. Meditation activates the parasympathetic nervous system. This system is engaged when the body relaxes and lowering blood pressure. Yoga, which commonly involves breathing control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. A 2013 review on yoga and blood pressure found an average blood pressure decrease up to 4 points when compared to those who did not do yoga. Number 7. Eat garlic. Both raw and cooked garlic help control high blood pressure and also reduce cholesterol levels. A study on 87 people with high blood pressure who consumed garlic found 12 points reduction in their upper blood pressure reading and 6 points reduction in their lower blood pressure reading. Number 8. Drink less alcohol. Drinking alcohol can raise your blood pressure. It's important to drink moderate amount. Alcohol can raise your blood pressure by 1 point for each 10 grams you consumed. A standard drink contains 14 grams of alcohol. Moderate drinking is up to 1 drink a day for women and up to 2 drinks per day for men. Number 9. Stop smoking. Not only does smoking hurt your overall health, but also your blood pressure goes up every time you have a cigarette. The chemicals in tobacco can damage your blood vessel walls and narrow your arteries, which cause higher blood pressure. Stop smoking to lower your blood pressure and prolong your life. Number 10. Get quality sleep. Like several other body functions such as your heart rate and breathing rate, your blood pressure also goes down when you are sleeping. If you don't get enough sleep, that means your blood pressure stays high for longer. Aim to get 7 to 9 hours of sleep every day. To get a good night's sleep, it's best to stick to a regular sleep schedule, exercise during the day, avoid daytime naps, and make your bedroom comfortable to sleep. For most of the people, these lifestyle changes are enough to get and keep blood pressure under control. If your blood pressure is very high or does not decrease after making these lifestyle changes, it's important to take medication exactly as your doctor prescribes. If you like the video, give it a thumbs up and share with your friends. For more health tips and healthy recipes, subscribe to our channel and hit the bell icon.